Medicare's fatal flaw: how payment rules harm kidney patients, minority communities. Kidney care is in danger, and brand new research shows that outdated Medicare payment policies may be putting lives at risk by clashing with the basic laws that govern biology. But here's where it gets controversial. These payment systems, especially those affecting end-stage renal disease, ESRD, appear to ignore precisely how the kidneys actually function, disproportionately harming minority communities. Washington Business Wire. The National Minority Quality Forum, NMQF, has just released the second article in its landmark health affairs series on the Physical Laws Framework, PLF. This article, entitled "Payment Systems Violate the Physics of Life: How ESRD Bundle Policies Disrupt Biological Order in Minority Communities," provides a detailed examination of how Medicare's current payment structure for ESRD stands in direct conflict with our fundamental biological requirements. What is the Physical Laws Framework? The Physical Laws Framework, PLF, is grounded in the notion that the human body operates under unchanging natural laws. Just as gravity isn't negotiable, neither are the processes that drive organ function and disease progression. By applying a scientific lens, the PLF questions whether healthcare policies work in harmony with these laws or push against them. When a policy contradicts the body's natural processes, it doesn't just create red tape. It speeds up disease progression and can shorten lifespans. The kidneys maintain a precise biochemical balance that keeps us alive. This isn't open to debate. It's physics, explains Dr. Frida Fisher, a practicing nephrologist and co-author of the article. When payment policies restrict patients from accessing phosphate binders at the times their bodies need them most, we're basically interrupting a fundamental process crucial for survival. Key findings: biology versus bureaucracy. The article spotlights how Medicare's bundling of oral phosphate therapies into dialysis center payments leads to stark problems. Biological reality: phosphate levels must be tightly controlled at all times, not just during dialysis sessions. When phosphate levels creep up, the body needs immediate intervention, often in the form of medications. Policy contradiction: by bundling the cost of these oral phosphate therapies into dialysis center payments, patients lose the ability to get these drugs from their pharmacies. This approach can leave dangerous treatment gaps because care is only dispensed on a strict schedule during dialysis center visits. Equity impact: Black Americans account for about 35% of the dialysis population, yet they face the greatest challenges when it comes to medication access. Many rely on pharmacies or long-term care facilities now excluded from dispensing these life-preserving medications. And this is the part most people miss. Innovation blocked. Novel therapies such as XPHOZA, which can significantly boost medication adherence and help control phosphate levels consistently, are essentially pushed out of reach under the current payment bundle. This is what happens when economic models disregard fundamental biological laws, says Dr. Janice Desir, co-chair of NMQF's Nephrologists for Equitable Kidney Care. The policy essentially assumes that waiting until the next dialysis appointment is acceptable. But high phosphate doesn't wait. It damages blood vessels and organs the moment it goes unaddressed. A scientific path forward, according to Gary A. Puckring, Ph.D., President and CEO of NMQF. The Physical Laws Framework is about respecting the measurable realities of human biology in our policy decisions. Engineers can't build stable bridges without respecting the laws of physics, and healthcare policy can't be truly effective if it sidesteps the laws of biology. This isn't subjective. It's a proven fact of how bodies work. This latest piece is part of a 15-part health affairs series that continues through March 2026, applying the PLF to a range of healthcare challenges. By focusing on biological laws, the series explores how well-designed policies can reduce health disparities and offer better outcomes for everyone. Join the national dialogue. NMQF urges healthcare leaders, policymakers, clinicians, and patient advocates to get involved with the Physical Laws Framework. Read the full article. https://www.healthaffairs.org/payment systems violate the physics of life, how ESRD bundle policies disrupt biological order in minority communities. Visit conservelife.org to download the complete Physical Laws Framework. Participate in discussion forums with healthcare leaders. Sign up for upcoming webinars and LinkedIn Live sessions. Access resources for integrating PLF principles into everyday practice. Explore the series, Health Affairs National Minority Quality Forum sponsored series. https://www.healthaffairs.org/sponsored content National Minority Quality Forum. Upcoming events. August 13th. LinkedIn Live discussion with the article's authors. August, date tentative. Webinar titled Applying Biological Laws to Payment Policy. November 5th to 6th. Cancer Equity Summit, spotlighting. The organization collaborates with healthcare institutions, community leaders, policymakers, and patients, leveraging data to advocate for healthcare that aligns with our biological needs. By championing policies that reduce hospitalizations, disabilities, and deaths, especially among at-risk populations, NMQF aims to ensure everyone has access to high-quality extended lives. Visit www.nmqf.org for more details. More news from National Minority Quality Forum. Back to Newsroom. https://businesswire.com/newsroom. We want to hear your perspective. Should payment models be urgently revised to reflect the natural laws governing kidney health, especially for minority communities bearing the brunt of these disparities? Let us know your thoughts and whether you agree or disagree in the comments below.